Now, in your book, you've given us several examples of how adaptive action can be used and implemented. Can you share one of those examples from your book?
One of the issues that we see repeated, patterns that repeat in all the organizations that we work with, we can name them as silos, where an organizational part gets so preoccupied with its own work that it doesn't connect with its partners in other parts. So one of the clients that we've been working with recently is a healthcare authority, and they handle and support province-wide services in healthcare. So they do the emergency transportation, and they do cancer, and they do children and women, and they do support for healthcare in the prisons, and they have all kinds of system-wide services. And historically, those have worked quite autonomously. They didn't see a need for interdependence. But as the strategy across the province becomes more and more integrated, it becomes important that those silos begin to work together. So our client is the Organization Development and Leadership Development Group for this institution that's trying to cross over all of these different functions and all of these different silos. And what they're doing is introducing adaptive action and pattern logic. So when they go to physicians and they say, okay, physicians, what are the patterns you're seeing? So what sense do they make? Now, what are you going to do to make them better? And they go to nurses who are working with cancer patients, and they see, what are the patterns you're seeing? How do you understand them? How can you make them better? And they go to people who are driving the emergency vehicles, and they say, what are you seeing? What are you understanding? What will make them better? And they go to psychologists who are working in communities, and they go to community care spaces, and they go to people who are working with elders. And so all over the system, there are people who are doing adaptive action. And what they find is that they are creating or discovering or harvesting resources across the system that were there but not acknowledged. And so bit by bit, they're creating networks of people who are interested in change, people who are interested in engagement, people who are interested in psychological health and safety, so that these system-wide patterns are able to be generated. At the same time, people are doing their local work. And one of the things they're discovering is that sometimes they are each other's sticky issues. And so we've had opportunities where we're doing adaptive action labs, many, many different teams with many different sticky issues. And one will look up in the middle of the lab and say, wait a minute, I think I'm your sticky issue. And the other one will say, yes, you are. How do we see that pattern? How do we understand it? And what can we do to shift it? And those conversations are happening when we are with them, but we're also building the capacity for those conversations to happen when we're gone, so that the whole system continues to do adaptive action experiments individually and at all the multiple scales and all across in every discipline. And so it's becoming a whole adaptive, self-conscious, complex adaptive system to provide healthcare services across the province.